Let's move on. There's lots happening in the pharmaceutical space. Dolo maker Micro Labs is in the eye of the storm over allegations that it has distributed freebies worth over 1,000 crore rupees to boost sales of the paracetamol drug that was widely prescribed during COVID treatment. Ekta is here with an explainer on how Dolo's sales zoomed since the onset of the pandemic and what the allegations suggest. Ekta.
Thanks for that. Well, yes, Dolo 650, which is the fever and pain-reducing medicine which shot to fame during COVID-19 and in many instances is now becoming the go-to pain-relieving drug, has come in the line of fire recently. Allegations brought up in the Supreme Court were that the manufacturer of Dolo, Micro Labs, distributed freebies worth around 1,000 crores to doctors to prescribe the 650 mg drug. Interestingly, during the period of March 2020 to Jan 2022, the oral pain market grew 23% due to COVID-19 related demand. Paracetamols were prescribed over other molecules such as ibuprofen to treat COVID. And it's during the COVID-19 period of around March 2020 to Feb 2022 that Dolo 650 mg rose to become the highest selling paracetamol drug. In fact, during this time, the Dolo brand, led by the 650 mg dose, grew to enjoy 22% share of the 3,100 crore worth of paracetamol-based drugs sold during the COVID-19 period, which means 22 out of 100 people were choosing to buy Dolo amongst all the paracetamol drugs during that time. And in terms of sales for Dolo, the 650 mg dose, despite being under price control or the national list of essential medicines, managed to generate sales of over 300 crores in COVID-19 during the period of March 2021 to Feb 2022. The sales in some cases touched over 10 to even 30 times of other comparative drugs in that space. So what could have happened? Interestingly, the Dolo 650 mg brand was launched in 1993, was one of the first movers in the market, and has at one point even enjoyed 80 to 90% market share in the 650 mg category. Eventually, the market share settled at around 50%. This has shot up to 58% during COVID-19. Interestingly, the Dolo brand sees this kind of stickiness only for the 650 mg variant, despite selling other mg variants as well, such as 500 mg. What tends to happen, doctors and experts point out, is that the brand becomes sticky. Keeping allegations of freebies aside, experts point out that 650 mg has in fact become a regular dosage for adults when it comes to paracetamol for years. And doctors tend to follow other doctors in terms of prescribing a drug, and this was possibly even more during a time of uncertainty, which was during COVID-19. Dolo, experts point out, grew because of the strong word of mouth, resulting in the brand almost becoming a default drug during this time. To illustrate it better, experts cite the example of Crocin. The drug enjoys one of the strongest reputations amongst the pain and fever relieving brands when there are many substitutes available. Similarly, Calpol is more associated with children but is also available for adults. And from the ibuprofen category, Combiflam is one of the top 100 brands in the country, whereas other substitutes don't see equal traction. Lastly, while the jury is out on whether or not Micro Labs did dole out freebies, no pun intended, the company says the 1,000 crore figure is indeed data which is generated over many years across their 14 divisions and a 6,000 strong field force. In fact, the only freebies, according to them, that they did give out were the ones allowed, such as books, pens and small mementos. They say the company, meanwhile, says it is currently cooperating with the investigation.